Hello, and welcome to the Clinical Care Options Infectious Disease podcast. I'm your host, Jacqueline Meredith. In our series on RSV, today's episode focuses on RSV seasonality in the United States this 2023-2024 season and vaccination considerations for adults. Joining me is Dr. Helen Chu, Associate Professor of Medicine at the University of Washington in Seattle. For the full online educational program, including downloadable slides, patient resource guides, and other podcasts in the series, please visit the link in the show notes for this episode. Now let's get started and hear what Dr. Chu has to say about this topic.
I'm going to talk about the seasonality of RSV in the United States this season. In terms of understanding the seasonality of RSV, really much of that data comes from children because children are often tested for RSV because providers recognize that as a cause of respiratory illness in kids. In adults, we still don't test frequently for RSV. I think that's changing somewhat because a lot of the testing is now a triple assay with flu, RSV, and SARS-CoV-2. But still, the testing in adults lags behind that of the kids. And so the data that we have is really limited by that. A lot of the information we have about RSV hospitalization and RSV seasonality in adults comes from platforms that rely on labs at hospitals. And so the CDC will pull in information about adults who are tested for RSV and then hospitalized, or are hospitalized and then tested. So only individuals who are quite sick and then also who have an RSV diagnosis are really captured in that data. And so it's an underestimate by far of probably the number of cases of RSV that are causing disease in adults, and also the number of hospitalizations due to RSV in adult populations. RSV has already started peaking in many parts of the United States. In general, we think of the respiratory virus season as starting in the fall, in November and December, and really continuing through the spring, so through February and into March. And so we would expect that with the cases of RSV that we'll start to see the numbers to go up, and then we'll probably see that sustain for 1 to 2 months, and then the numbers start to come down. It usually starts in the Southeast, in Florida, and then we start seeing increases in numbers of cases, usually on the East Coast. And then from where I am here in Seattle, we're also starting to see the numbers of RSV cases go up, particularly in the Children's Hospital. Usually what happens is that we see the RSV season and the influenza season not necessarily overlap with each other, but given how unpredictable things have been over the last couple of years with all three of the viruses, flu, RSV, and SARS-CoV-2, it's not really clear when we'll see flu and SARS-CoV-2 really increase. And it could be that we have all three at the same time, the triple-demic like we had in years past. But we don't know that yet. We just do know that RSV cases are starting to go up. It's hard to predict, however, because as we know, during the pandemic, what happened was that a lot of people had no exposure to RSV. And so that left a pool of people who were susceptible to RSV. And so that may change the dynamics of how long the virus will circulate for in the population. There might be more people who could potentially get infected and continue to spread the virus. And so the season may be a little bit more prolonged than in years past. I think what that means in terms of getting vaccines is that really right now is probably a good time to get vaccines for all three viruses. And when we think about the RSV vaccine, we know that after you get your vaccine, it takes approximately 2 weeks to start getting protective antibody levels. And so you really want to get it at the beginning of the season rather than partially through the season. I think what we do know from the vaccine trials, fortunately, is that the antibody levels do stay elevated through at least 6 months. And there's still data coming out to look at whether or not the vaccine can protect you for greater than 1 season and potentially 2 seasons. I think it's a little bit too early to know what to do with that data, but at least the protection will last the 6 months or so until the season ends. We have data from coadministration of the flu vaccine with the RSV vaccine. And the data that we have shows that the antibody levels that you get when you give both vaccines together are good. They're equivalent to the antibody levels that you would get if you give the vaccines one after the other. And what that means is that for most patients, it's a good idea to try to get your patients to think about getting your vaccines together for multiple reasons. The first is that we don't know the predictability of the season. It's very likely that we'll have a flu season that's in December or January. And so you want to get vaccinated before that. Those numbers start to go up. It's often difficult to get adults to come in for provider appointments. And so logistically, it just makes sense to try to get as many vaccines in at a time. And based on the data that we have, it does seem like immunologically that you are able to get both vaccines at the same time, and it doesn't lead to decreased antibody response to one or the other. The way that I would approach that conversation, if you're talking to patients about getting all three vaccines together, the COVID, the flu, and the SARS and the RSV vaccine, is really just sort of talking about these points that sometimes it's unpredictable when the viruses will circulate, that it's difficult to come in several times in a row in the course of a couple of weeks to get one vaccine after the other, and that really potentially putting them all together, you can just get your side effects over with. It is true that you will have a sore arm after getting your flu vaccine, your COVID vaccine, and your RSV vaccine all at the same time. But sometimes some people prefer to get all of that over and done with rather than spread out over the course of several weeks. In terms of thinking about the RSV vaccine and giving it in conjunction with the COVID vaccine, it is true that we don't currently have any data showing whether or not giving those two together is going to lead to similar immune response compared to giving them separately. But the CDC, the ACIP in general, has just recommended giving all three together for the sake of simplicity, both from a logistics standpoint and also being able to be maximally protected heading into the season. So in summary, I think the main points are that the RSV season has started in most parts of the United States, that it is unpredictable right now how much that will overlap with the flu and the COVID surges, but based on prior years and based on experience, it is likely that we'll have all three viruses circulating at the same time again. And so because of that, it's important to think about giving vaccines for RSV during the season while it's circulating, and that should be able to protect patients for the next 6 months until the end of the season. And that the data so far shows that it's safe and it generates good immune response to be able to give the vaccines together, the COVID, the flu, and the RSV. And it's probably a wise choice to do so because of the fact that all three viruses will circulate simultaneously this year.
Thank you very much to our faculty for reviewing the outlook of the 2023-2024 RSV season, and thank you to our listeners for joining in. Please be sure to check back for more episodes on important infectious disease topics. Thank you and have a great day.